This definitely is a proud moment for me. I'm truly honored and grateful for this award, but not only does it highlight me and my accomplishments, but it also recognizes the work that we as social workers do to make a difference in the lives of others. So, as military social workers, we have the opportunity to actually work in several areas, including substance treatment. And so I didn't necessarily choose, but rather where the need is for social workers to fill in, that's where we go. But I think more so it's about being able to help individuals who are struggling or going through difficult times, watching them go through the treatment process and get better. I started out as an elementary school teacher, so teaching has always been my passion. I'm grateful for this career broadening experience, providing education to family medicine residents and to medical students. So, our family medicine doctors are usually the gateway to health, including mental health. So I think it's important that the whole person concept is considered when treating patients and how the biological, psychological, and social factors may impact health and treatment. For example, if you have an individual who does not have a car, that's going to prevent them from getting the care that they need. And also taking in other considerations. Does this person have a place to live? Are they employed? How is all that impacting their health and their treatment? And it's important for our doctors to recognize those issues and how that may impact their care. So social worker is such a wide career field with so many opportunities. My advice would be to take the time to explore these possibilities and seek out chances to perhaps shadow or even volunteer in the areas of their interests. When it gets rough, they have to remind themselves, why did I choose this career field in the first place? Because it's not always easy, but making sure they understand and remember why they chose to go into this profession. So being a Gamecock to me embodies the principles of leadership, perseverance, and resiliency. And as we say, the fighting Gamecocks lead the way. And ironically, as officers as an officer in the Air Force, I'm also taught to lead. So leading as a Gamecock and leading as an Air Force officer.
Okay, so I'm here with
Carla Dameron.
All right, Carla. In other interviews, you've said that your work in the social work profession influences your writing, especially the orchid tattoo. Can you tell us a little bit about that?
Well, The Orchid Tattoo, which is the novel that came out last year, is about human trafficking. And the genesis for that novel was I was working with National Association of Social Workers for about 5 years, and I did some advocacy work to get some more progressive anti-human trafficking legislation passed. And in that work, I met survivors and law enforcement and counselors and advocates that taught me so much about how pervasive that crime is, and I found it quite alarming. And so, as a social worker, when you hear these stories over and over and over again, it hurts your soul a little bit. So that's what compelled me to write. When something's really bothering me, I want to write about it. So, and I decided I wanted to write a suspense novel because I wanted it to be something that a lot of people would read and maybe get some education about human trafficking and how it happens. The other way social work influenced that book is my main protagonist is a social worker, Georgia Thayer. She works in a hospital and she is in every way a social worker. I mean, she is determined and headstrong and gets herself in trouble doing the right thing. And yeah, so if I can honor the field in my writing, it makes me really happy.
How did your transition from a career in social work to a full-time author happen?
Well, I didn't completely transition because I'm still doing social work. I'm working for communities and schools in a small part-time job. But also, if you're a social worker, it's not what you do, it's who you are. So you don't ever really retire. I feel like my social work practice now is my writing for the most part because I always write about social issues and whatever I'm writing. And so I feel like I'm still a practicing social worker. I just sort of have a different avenue for doing that.
Okay, and you've received so many writing awards. What does this Social Work Excellence Award mean to you?
I'm really proud of the awards that the Orchid Tattoo has won, but as a social worker, an award from my people, that means everything. That is just stunning to me. I don't feel like I deserve it. I'm honored beyond belief. I've been kind of lucky because I've been a little bit in the public eye with my latest book, and I've been able to talk a lot about social work. But there are so many social workers that do incredible work that we don't know about, and I wish one of them was winning this award, the quiet ones that are just in the trenches doing this very difficult work, for many, many hours every week, long beyond 40. So I'm proud to win the award, but I'm not sure I deserve it.
And what's your advice for an aspiring social worker?
I would say this is a very wonderful, incredibly challenging career. And so in my work with social work interns, I focus neurotically all the time about self-care, because you can burn out. I know so many social workers that have burned out, and I have experienced burnout. So just, make sure you're taking good care of yourself. You're developing the skills that you need to set reasonable expectations for yourself. You're not going to be able to save everybody you want to, but you can't. So accepting what you can do and doing your best to accomplish that. And then cutting yourself some slack and giving yourself a break and going home and nurture yourself so that the next day you can go and be the best social worker you can be. I think that would be a really important thing. The other thing I would say is what I love about social work is that it's so varied. There's so many different things you could do. I did mental health for 33 years, and then I was an advocate at NASW, and now I'm writing and doing supervision. Explore that. There are lots. If one little area of social work doesn't work for you, there are so many other things to explore, and be a professional social worker. That's one of the best things about the field. The other good thing about the field is I don't think robots are going to replace us.
On this homecoming weekend, what does it mean to be a Gamecock?
Being a Gamecock is wonderful and frustrating. This is homecoming weekend, and we're playing Florida, and Florida is an orange team, and I hate all orange teams. So I want very much for Carolina to win. But the other thing I would say is I love basketball and volleyball and baseball and football. But wouldn't it be magnificent if 1/4 of the athletic budget went to social work, went to support professionals that are going to be the ones that take care of people that are unhoused and children and folks with mental illness? Wouldn't that be incredible? I mean, I'm happy that the athletics department does as well as it does, but wouldn't it be nice if there was a little balance with that?
So I'm here with
Sarah Goldsby.
Okay, Sarah, congratulations on winning the Emerging Leader Award. What inspires you to pursue a career in alcohol and drug abuse prevention?
Well, what's interesting is I didn't really pursue a career necessarily in alcohol and drug use. I wasn't seeking that out, but it was a field placement opportunity while I was here in the College of Social Work's master program that really got me into a policy opportunity that happened to be at the Department of Alcohol and Other Drug Abuse Services. And it was during my time there that my family was experiencing a lot of turmoil related to addiction, and it seemed almost serendipitous that I was in a place among people who understood addiction as a disease. So it felt right to stay.
And how do you envision your leadership contributing to this field in the future?
So I've been lucky to be involved with my national association, the National Association of State Alcohol and Drug Abuse Directors. And so in that leadership role for the last 3 years, we've been able to really take a national focus and do a lot of work in Washington, D.C., putting a focus on the healthcare workforce, the behavioral healthcare workforce, and the workforce that we need in addiction services. And so in multiple ways, I feel like I've had some influence in drawing attention to the opportunities that social work has in the field of alcohol and drug use, and the priority that we need to place on fostering and bolstering a strong, robust behavioral health workforce for the nation.
Tell us a bit about your dual degree, MPH and your MSW, and then how does that influence your work?
So the MSW MPH dual degree program that I did here really helped me build out my entire toolkit and skill set to be a healthcare administrator focusing on vulnerable populations. And that's precisely what I do now. I'm a healthcare administrator, really administering programs, services, and funding specialty care for people who have substance use disorders and would otherwise have no means of affording such college specialty services. And so in a way, that dual degree really sort of gave me what I need to focus on that population that's in such need of healthcare services.
Right. You've received a number of awards. What does the Social Work Leadership Award mean to you?
Well, this award means a lot to me because, well, two things. I think any award from the College of Social Work means so much to me personally because this college gave me so much in my personal and professional life, more than I could ever measure. And coming back to the college just is really near to my heart because of the faculty and staff who fostered my development. But in another way, I think it really does sort of send this message that social workers are always coming into leadership roles. I look around the state and the nation, and everywhere I see social workers in leadership roles. And so as any young and emerging social worker may not think that they'll ever be in a leadership role, I always tell folks just beginning their career that inevitably they will be a leader. That's just what social workers are.
Right.
So
going based on that, what advice would you give an aspiring social worker?
Well, first of all, please become a social worker. The state, the nation, we desperately need social workers, and we will for a very long time. So the career opportunity is immense. But what I would really advise anyone becoming a social worker to do is to just keep their options open and follow the path as it unfolds before you. I say that a lot because a lot of folks have one specific idea of what kind of social work they might practice, but if you keep yourself open and flexible, there are endless opportunities to do work for multiple populations in multiple service and programmatic ways. And so I would just suggest that anyone in the social work field just stay open to possibility.
And on this homecoming weekend, what does it mean to be a Gamecock?
Well, my connection to the University of South Carolina and being a Gamecock really is with the College of Social Work and with the Arnold School of Public Health. And so anything related to being a Gamecock always brings me right back here to the college. And I think being here with homecoming and with Dean Brown's leadership to really celebrate and recognize alumni, it just feels special to reconnect with the roots of what really developed me as a professional that started right here in the College of Social Work.
All right, thank you. So I'm here with
Sarah McClam.
Okay, Sarah. What was your journey to becoming a social worker like?
Well, my journey didn't start off to be a social worker. I graduated from Newberry College in 2 years, and my goal was to go to medical school. And once I started medical school, I found out I was going to have my first child. And my husband and I thought about it and said, you can do this. I said, no, I can't. And bottom line, I decided not to. I decided to have the baby and take care of the baby for a while and then pursue my education, which I ended up doing social work. My son that I had ended up being the doctor. So it became very full circle. Mm-hmm. I really do believe that I have touched more lives in this profession. It was meant to be. It was very definitely meant to be. It was not a coincidence, and I've enjoyed every day of it. I am one of the few people who can say I love going to work.
What does the Dean's Award mean to you?
Well, it was certainly a surprise. I'm very motivated, and every day is a new day for me, and I see so many different people in so many situations. And I do know that I make a considerable change in people. I've been in this business long enough that children that I serve come back as an adults now and never forget some things that I told them. Like, you're writing your life story every day. Make sure you do your homework and you do the right thing. And so I've seen that change, and I know every day that the person that I am touching, I'm making a positive change because they come back and I see them getting better. And that's the greatest reward you can get.
Okay, and on this homecoming weekend, what does it mean to be a Gamecock?
Oh my gosh, you would have to see my house because it is decorated in Gamecock. I have to pause for Halloween and Christmas, but it's decorated in Gamecock exclusively. My parents, my whole family bleed garnet and black. I have a daughter-in-law who went to Clemson, and we asked her to stand outside 30 minutes before she comes in, but other than that, we're Gamecocks. I have a sheepadoodle, and he is a Gamecock. Honestly, I have recorded this, and you would have to see he watches every girls' basketball game without a pause, sit and watches it. He knows when people start clapping, he should start jumping, And I've also trained him on the new commercial I'm sure you've seen with the Clemson guy opens up his shirt on the first date. I said, that's a Clemson, and we don't like Clemson. And George goes and growls and tries to get him. So you have to be a Gamecock even if you're a Pitt.
Okay, and one last question for you. What would you tell an aspiring social worker coming in? Some advice you would give them?
For someone wanting to be a social worker?
Yeah.
You will never be in a job where you touch this many people in a positive way. When I retired from the state, they determined somehow or another that I had seen over 250,000 clients at that point. And you think you touch that many people and you help that many people and you start where they are and you get them where they want to be.